Now, in what is likely to elicit approval from members of the public, the government is yet again set to impose additional taxation measures on Kenyans as it seeks to raise monies that will be channeled towards the achievement of universal health coverage. The Social Health Insurance Bill, SHIF 2023, which establishes the Social Health Insurance Fund that will take over from the National Hospital Insurance Fund, NHIF, will be used for preventive and promotive of primary care services at community, dispensary and health center levels, and build a chronic illness and emergency fund that provides for chronic illnesses. Has a raft of proposals that will rattle Kenyans. The government is targeting to deduct 2.75% of the gross salary of the over 3 million employed Kenyans to raise monies for the SHIF, with the minimum contribution capped at 300 shillings. There is, however, no clapping on the minimum contribution, as the government argues that the blanket contribution of 1,700 shillings by every salaried Kenyans is unfair and favors higher income earners. President Ruto said this, and I quote, "We are changing the funding system so that we can allow the vulnerable to access NHIF free of charge, and those who are in the lower category to pay less, and those who earn more, like me, to pay more." End of quote. Under the Social Health Insurance Bill 2023, those liable to contribute are every household, an non-Kenyan resident residing in Kenya for a period exceeding 1 year, the national government, the county government, and any other employer. For a household whose income is not derived from employment, there will be an annual contribution matching 2.75% of the household's income that will be determined by a social economic assessment that will be carried out by community health workers across the country. Those classified as needy will be covered by the government through a 26 billion shillings kitty. Every Kenyan will be required to register as a member of the Social Health Insurance Fund. Other reforms include the Chronic and Critical Illnesses and Emergency Fund, which will be publicly funded. It targets complications such as diabetes, hypertension, and cancer management and emergency treatment, and as occurred on Article 43 of the Constitution, which states that no person shall be denied emergency medical treatment. The fund covers the cost of management of chronic illnesses in case a patient depletes the social health insurance coverage. Another proposed bill geared towards the achievement of universal health coverage is the Primary Health Care Bill 2023, which establishes a framework for the delivery and access to primary health care. Through the bill, 100,000 community health promoters will be hired and will be tasked with being the first point of contact for patients. The bill aims at improving services delivery at the primary health care levels, that is dispensaries and health centers, which will be catered for by the government through the exchequer. The bills are set to be tabled in Parliament for consideration. This is Cuba News.